a question really about the autism work you're taking forward. Will you be involving the Autism Board at Croydon Council when you're looking at that, or will it be looking at just patient experiences, resident experiences with children? Just wondered if you could explain how you're going to approach that work.
Earlier this year we had an autism event, and prior to that the team and volunteers were going to existing active autism groups, who are at the front line talking to people who are parents of and people with autism under the age of 21, because we have a criteria to engage the young, seldom heard. So we put in a lot of work on the ground, going to autism groups, and held a very popular event. It was outstanding, the event. So many people there had actually never heard of Healthwatch before, but some of them were pretty active in the autism community. And one of the ways they heard about that is through the Autism Champion and through the Autism Board, the Autism Facebook page. So by holding that event, it was a launch pad. This is the patient experience, and that got the conversation going. It raised our profile, and it also, that independent voice, the platform for people with autism and under 21s, and the Autism Champion, the counsellor whose name escapes me at the moment, but he was speaking at the event. Andrew Rendell, thank you. Andrew Rendell, and he has taken that report forward. And part of our role, so that was earlier this year, February, I think. So February 2017, the team will go back to the autism groups and say, what's changed? How are you feeling now about the autism services? In response, to be fair to the CCG, in response to our autism report, the CCG came back step by step with answering an action plan to every single recommendation in our autism report. That autism report is available on the front desk and on our website. So part of it is, in February 2017, their team will be going to the Autism Board and saying, this is improved, this hasn't improved, can you continue to take it further? So we're at the early stages now, it's a work in progress.
I'm obviously very impressed with the report that's just been given. And I don't know what the floor looked like when you asked about how many people had heard about you last year and how many people heard you this year. But perhaps it's grown quite rapidly. How well are you embedded with your knowledge and the advice you give to local clinics, stroke, GP practices, etc.? I only say this because earlier on this year, and I won't mention the practice and I won't mention the other relationship, but I got the feeling that who is Healthwatch? What were they doing here anyhow?
But we have statutory functions, and by charm, the team's charm, we try and invite ourselves to clinics, hospital services, etc. And 99.9% of the time, the GPs are willing and engaged.
And all their staff?
And then, they're buying from the leadership, and then that opens up staff doors. But who are Healthwatch? That's part of trying to raise the profile of who we are and what we do, and that we've got statutory functions. Every local authority in the country has one. The legislation is that they have to listen to us, but not necessarily act. But there are ways of making people act on the listening, as you can demonstrate through our press releases, a little bit of embarrassment, a little bit of ruffling of feathers. Also, we sit on a number of boards, Safeguarding Board, CCG governing body, and that is these are public boards, minuted, and that can raise awareness of Healthwatch. It's not Healthwatch, it's the patient representation, it's the patient voice. It's not even the brand, it's actually all of us are patients, one way or another, and all of us are waving the patient representation flag. And it's also almost educating the staff, and that we're here to help, we're part of the solution, and that, as I said in my quote, that the GP manager was pleased with our report and thankful, and that it was inspiring the team. So it's bit by bit. If you don't know, the GP doesn't know, but now they do, I imagine.
I run the Patient Participation Group Network. I hope my question, Charlie, is going to be helpful to you. My question is really directed at the Mayor and anybody here from the Council. The work that Healthwatch has done has been extremely important in many, if not all areas, and in being the patient voice. One of the massive hits that Healthwatch has taken this year is the loss of a particularly important member of staff who led the interim views. And unfortunately it seems we're not able to do interim views anymore because of the funding cuts. So Mr Mayor, I would hope that good representation can be made to the Council to restore some of the finance. I know finance is difficult, but it's a plea really from those of us who did interim views, because interim views are very, very important, and they need to be reintroduced, restored, so that the patient voice can be really heard. I was going to say more so, yes, more so than we're able to do at the moment, because you've got people here who are very, very happy to volunteer to do interim views, and that's an important whole really in the way that Healthwatch is able to function. And it's an important piece of work for elderly people, for liaison with Croydon University Hospital, for being able to go into care homes, and it's just not being done. So please can I make a plea to whoever has got influence, and also people on the Health and Wellbeing Board. This is not able to be done now. We need it back. Please can we have some money?
We just have to wait and see what we get. But thank you all for your support on that.